I asked Roseville Dr. Tom Hopkins about the state of COVID in our area. We started with vaccine appointments. There's a lot more availability.
So we're seeing the slowing down of that big demand because we have a good supply right now.
Rural communities are seeing the opposite.
It's just been a problem with access in general to, higher quality care and in some cases affordable care, right? So some of people in rural communities have been kind of left out a little bit in this whole process.
Supply is getting better with things like mobile clinics, but a lack of information and education is creating hesitancy.
They don't see that sense of urgency, especially they may be in an area that doesn't seem like COVID is an issue for them.
Hopkins says we're especially seeing it in communities of color. That's mostly due to a lack of trust.
Suspicion that the virus is not really somehow going to affect them when we know that it really is, that they represent a high-risk group. We also know that there's people who don't trust based on past experiences. For me, being a part of that population is to really lead by example, right? To show that the efficacy, show the data, that the numbers have decreased, the number of COVID deaths and hospitalizations in the high-risk population.
Hopkins says we're on track, even if the big counties in our area haven't changed tiers in a few weeks. He says it's hard to predict if we will fully reopen on Governor Gavin Newsom's target date of June 15th, but we have to be careful, especially with new variants.
Even if that happens, you can't let your guard down because, again, the tiers were set up for a reason. So what we don't want to do is go back.